So this is like Oprah, but she has coaches, right?
And
She
a
had
forklift
coaches.
car.
I feel like it's like Sportsnet, you know, when they all just
Sportsnet?
talk
Okay.
about hockey.
If we don't have the green screen, you could have put up the.
Yeah, one's read-only and one's...
It's the headphones.
Do I have to give you permission?
The mono mix. It's a mono mix, but I think the headphones are good.
Nope, we're good. And do you want to start asking questions then? Something like that.
Sure. So...
Welcome to this week's Body Matters. We're here for our first live chat session. We'll have another one at the end of the course. We got Frank and Jimmy working the video cameras, and Andras and Jasmine here are going to sort of talk about what your questions and tell your questions to me. Andras will be a little bit of a what do we? Demo. There we go. That was the word. I was going to use something else, wasn't appropriate. And Melanie is going to be monitoring the discussion group. So please send in your questions, and we'll feed them in with some of the ones that came in before, and we'll try and get a good mix of things that are going on. So, what's the first question?
The first question is, how do you isolate muscle groups when lifting weights?
Interesting question. The first thing probably the most important thing is that trying to isolate a muscle group when lifting weights is not done for health. Most of this course is about health. If you want to do bodybuilding, where you are sculpting your body into a particular picture, then you'd want to isolate muscle groups because you want this muscle to be bigger more than this muscle. But functionally, when we're trying to do things for health and get around life easier, we are always using our muscles in combinations with each other. And so we wouldn't necessarily want to isolate muscle groups. But if you wanted to, you can't do it completely, but the idea is to review the anatomy. And in this course, we've given you some references where you can go to some online sites and see muscles. And so if we take Andras here, we can think about certain muscles, and we have a biceps muscle, which has two heads. And so one comes from deep in there and one over there, and that crosses two joints. So one crosses the shoulder and the other crosses the elbow. And then that will bend the elbow. But we have another muscle that's deeper called the brachialis, and that also bends the elbow. So if we want to get rid of the biceps, and we only want to focus on the brachialis, we would do things in which we don't use the shoulder, or we put the biceps completely on relaxation. So we might do it over here. The other thing is that the biceps, besides bending the elbow, it also turns the hand this way. Brachialis does not. So if you want to isolate the brachialis, you can turn the hand this way. And that way, if you're just doing curls in this way, you are now not using your biceps or minimizing its effect. There's lots of books and different types of training programs for your individual muscles. In the calf, we sort of work the major calf is the gastroc part, and that we work by working when the knee is straight. If we bend the knee, we remove the gastroc and we work on the soleus. So there are different tricks and trades to do particular muscles. And so that's really as a nutshell. But again, when we're functioning, when we're running, when we're lifting, when we're moving things, we're trying to get the body to work with the muscles in a coordinated fashion in order to avoid the injury. So it depends on what your objective is.
Okay, so the next question is, how does one come up with an optimal training program?
Well, the first thing is, what is optimal? Optimal means that you have a particular objective in mind. So do you want to run a marathon? Do you want to be a bodybuilder? Do you want to just be able to walk 30 minutes without getting out of breath? So we've got to define what you want. And then we have to define what level of fitness you're in. And so somebody who is unfit needs a program that is much easier than somebody who's been training for 3 years or even 3 months. And so we have to define those particular issues. And then what type of risk you're willing to accept to get injured. Perhaps you want to run a marathon in 3 months. Well, that's going to be a different optimal program than if you want to run a marathon in 6 months, but make sure that you're never getting injured. You might say, marathons in 3 months, I'm willing to take the risk. That's a different optimal program.
When trying to build or maintain muscle mass during weightlifting, how many reps, how much weight, how often is enough to be effective?
So now we have a more specific objective. Just coincidentally, those questions occurred right after each other. No, they didn't. We moved them around. In some of these questions, we tried to move around to have some flow. So in this case, let's break down that question. So read it, the first phrase of that part.
When trying to build or maintain muscle mass during weightlifting, how many reps is
Okay.
enough to be effective?
So when trying to build or maintain muscle mass, so we have two questions. Build muscle mass, maintain muscle mass. Those are different. Okay? Continue reading from that part.
How much weight
Continue, how much weight?
and how often?
And how often. So how much weight means immediately this person is interested in weight training as opposed to other types of resistance training, because it could be how many push-ups should I do or how many pull-ups, and that would be different. So we think about that question, we break it down, and in the lesson that you guys had last week, which was on evidence, it was about thinking about the question and trying to frame it. And part of what I do also in research is consulting is to try and help clinicians understand and frame their questions appropriately. And it's true for all of life, no matter what you're doing, even if you're thinking about buying a house or what school you want to go to try and think about what your objectives are. So we now know that they want to build or maintain muscle mass. Those will be two different things. And they want to do weight training. And now they're asking how many sets, reps, and what was it?
How much weight and how often?
And how often. So we go back to the FIT principle: frequency, intensity, type, and timing. Frequency would be how many times a week. In general, we talk about maintenance being twice a week. If you want to improve, it's got to be more than twice a week. Now this is in general, because if you're regularly training 3 times a week, then maintenance is going to be 3 times a week. So everything works off where you are at this moment. And then if you want to get better, we build from that up. If you do less, you will reduce in general. But maintenance, twice a week, building 3 to 4 times a week in terms of frequency. Intensity must be at an intensity that your body is not used to seeing. So if you're normally lifting 20 pounds and you lift 25, you should see a training effect. Type, you can do bench press, you can do incline bench. So you could do it just flat on your back, or you could do it where you're sort of where your back is up, your head is tilted, so that's an incline. You could do a decline where you're in the reverse direction. So these different types of training are slightly different, working the muscles in slightly different ways. And in an optimal training program, we would vary that because your body gets used to a certain type of stimulus and then it will stop adapting. So we do a slight change and then the body starts to adapt again. And then timing would really be well, actually, I screwed that up, actually. Ooh, sorry. Frequency was more how many, so we can talk about the frequency being how many reps should you do. So we can do 3 sets of 10 or 4 sets of 6 to 8. So within that, what we talk about is the more you do in a row before you rest is much more like running a marathon. So that's more like endurance. So if I want to train an endurance type program, I'm going to work at sets of 20, 30, 40, 50. And I'm going to take a short rest, because when you're running a marathon, you're not really resting in between. If I want to work my muscles to get bigger and stronger, it's actually very high intensity, high weight, maximal isometric contraction for very short periods of time, because you can only hold that maximum for a short period of time. And so you might do 4 to 6 reps, and you might repeat that only 4 to 6 times. So you're doing less amount to get bigger, but you also need more rest in between so that you can recover. So if I'm lifting 100 kilos, then I get exhausted, and then I need a longer rest. I might take 2 minutes rest or 2.5 minutes rest, and then I'll do it again. And then I'll do that 4 or 5, 6 times. So those are the standard programs. And then if you're doing endurance, 2 sets of 20 to 30 to 40 with 30 seconds rest. Most people in the gym want a combination of endurance and strength, and so we say 3 sets of 10 to 12. There's nothing magical about these numbers. If you want to increase muscle mass and strength, you must fatigue. And as long as you fatigue, that's important. There are studies looking at 1 set of 10 versus 3 sets of 10. As long as you fatigue, you are going to build your muscle mass. And then, of course, the timing is the rest. Do you do it twice a week, 4 times a week? And in general, the higher the intensity of exercise, the longer the rest required. So you're working super heavy weights, you give yourself 2 days rest. And if you're working very light weights, like just, or it's 5 pounds, you can do that every day because your body's recovered. Every time you do exercise, you break down muscle tissue. You must then give it time to synthesize back and even become stronger. The more intense the exercise, the longer it is, the more the tissue breaks down, the longer the recovery you need.
All right, so the next question is, after 50, so once an individual is 50 years old or even older, how do they prevent, like what can they do to prevent muscle loss?
The principles for anybody who's over 50, there's nothing magic about 50 or 60 or 20. The principles are always the same. And that's you must use resistance exercise, you must force the muscle, and you do a certain amount of reps, and as we just talked about, 3 sets of 10 is fine. You can do 1 set of 10 too. You could do as long as you're fatiguing, and that you do that several times a week in order to gain, twice a week not to lose. That's in general, and that's more for younger people. Once you get older, the recovery time in general is longer. So we don't want to push as hard after the intensity. At the same time, with aging, our muscles will start to break down normally because we're just not doing as much, plus the whole aging process. And so it's very important to do resistance exercise. In the 70s, everything was aerobics. And it was, when I went to medical school, people were saying it's dangerous for older people to do weightlifting and resistance exercise. Now, it's part of the prescribed treatment. As you get older, you should be doing resistance exercise in order to maintain your muscles, in order to be able to do things like getting out of a chair. People who are 80, 90 years old can have trouble just getting out of a chair. And the lower the chair, the more difficult it is. For instance, sitting on a toilet can become very difficult for people as they become older and lose muscle mass. And the exercises we do mimic those activities. So it would be getting out of a chair is one of the exercises that we can give, which is similar to doing squats. You just do it in a safer way, where if they fall, they're falling into a chair.
All right, so the next question is a bit more of a case. I'm 62 years old and I have a very desk-bound job. I've noticed that I have lost muscle strength due to long hours sitting at the desk. I have OS knees. To help ease my knee pain, I use knee guards. Could knee guards actually weaken the legs or knees further? Should I take off the knee guards when I'm exercising?
So first, the student's talking about OS knees. I don't know what that is. I think the S is right next to the A on the keyboard, and they meant to hit OA. So we'll pretend that it's osteoarthritis, because I know that OA stands for osteoarthritis. So let's pretend that it's osteoarthritis knees, and that would cause pain, that would cause some stiffness, and that would cause some disability. And a lot of that is due to weakness. So within this framework, what we want to do is strengthen the knees. Again, there are certain types of exercises. They're generally going to be some type of squat exercises. There's no one exercise that's completely better than the other. Squats, lunges, those types of things. Being as part of a whole general fitness program is the best. There are certainly things that you can do at home. And as I said, doing squats in and out of a chair is an easy one, because that way if you fall, you're just falling back into a chair. The knee guards. There are different types of knee braces. Knee guards to me is more just a covering of the knee in case somebody whacks you in the knee, or if you were kneeling down a lot, that you don't want to kneel on your knees because the pressure hurts. I'm not sure if that's what you meant, or knee braces. They're not going to generally, in this condition for osteoarthritis, they're not going to cause your knees to become weak. but they're not going to cause your knees to become strong either. And so there's certain types of braces we call unloading braces, which will relieve pain in some people, and they feel better. But when they take the braces off, the underlying problem is still there, the weakness and the stiffness. And so if you want to treat the underlying problem so that you don't need the braces, or maybe don't need them as much, you've got to get back to restoring the function, and the only way of doing that is through the exercises. And that you can go see a sport medicine physician, maybe your family physician if they're in tune, physiotherapists, athletic therapists, kinesiologists. There's lots of different, some chiropractors give a lot of exercises too. So there's a lot of different types of health professionals that you can use, and you can just ask them how comfortable they feel and their knowledge, and work with them. If the exercises are working, that's great. If they're not working, they should be changed. That's working in follow-up. There's nothing that works for everybody. Just because I saw a patient today who was given exercise by a chiropractor and they were worried because they weren't getting better, they got a little bit worse. It wasn't the exercises. The exercises were good. It's just they only went to see them once. They came to me. I changed them. I'm sure if they had gone back to the same chiropractor, the chiropractor would have changed. Well, I'm not sure, but I would hope that the chiropractor would change them because I had added information than the chiropractor did at the beginning. I see lots of patients where I give exercises to. They come back. They're not doing well. I change the exercises. It's part of that finding the right exercise at the right intensity with the right rest for that particular person. We do our best guess, and then we follow up.
So a follow-up question that was asked just on the forum by Naran Chand. They're asking, how important is genetics in building a particular muscles, so such as the rectus abdominis or the abs?
Wow, great question. Thank you for asking on the discussion. It makes me feel like it's really live and not pre-prepared. Genetics are super important for body build. I have a friend who really didn't work out, and we were in medical school together, and he was just always cut. When he was younger, he worked out, but in medical school he didn't, but he still remained cut, and I didn't. So I blame it all on genetics. So genetics is important for your body type. Andras is tall and lanky. Other people are stocky and big, and so that's part of it. And the ripped abs and the six-pack for the abs, we have to differentiate between the muscles and what you see. Because to get the ripped abs, it's also about no body fat in that area. It's not just that, because remember, there's the skin and the fat and the muscles. If you've got fat between the muscles and the skin, you're not going to see the muscles, but they might just be just as strong. So I think that question is more about appearance. And there, some people will put on body fat around their stomach, and some on their hips, and some on their neck, and in different areas. So that's got a lot to do with genetics as to where you put on body fat.
So I have another question that was on the discussion board posted just now. So you talked about the importance of being active as an elderly person. Does being active and in good physical condition when you're young give you an advantage when you're older? Or necessarily give you an advantage?
Yeah, so if you're physically active when you're young, for your muscles, I don't know this for sure, so I'm going to make some stuff up, but it'll sound good. For your muscles, the muscle function recovers and changes very rapidly within months to years. So you have somebody who's trained and been a bodybuilder and they stop training, they shrink a lot. Look at Arnold Schwarzenegger today compared to when he was a bodybuilder. He's just much smaller. There is one big difference, and that's your bone structure. And so one of the problems is if you have thin bones growing up, they don't recover afterwards. And it's a big problem. We had the pregnancy lecture, I think this week. Last week was the pregnancy lecture. Did we have that yet?
I'm not sure.
I'm not sure. If we've had it, well, anybody can go see it. So, because it's all open now. But in the pregnancy lecture, we talk about female athlete triad and REDS. And the problem there is that if women who exercise excessively and don't eat well can lose their menstruation, and there's this underlying problem that their hormone balance is messed up. And one of the hormones that gets messed up is estrogen, and that helps build bone, and so their bones become weak. And you can have a 30-year-old who's got the bones of a 70-year-old, and that will never recover. So in that sense, it's super important that we stay in shape. Apart from that, I remember I was practicing medicine. I had graduated in June 30th. There was a Montreal Marathon in September, and I went to work at the Montreal Marathon. And there was this guy, this was 1986, and there was this guy who, 76 years old, and he ran the marathon. And I said, wow. I said, like, he was just in a medical tent. He had some blisters or something. You must be one of these guys who was running in the 40s and 50s when nobody ran. And he goes, no, I was a couch potato until 5 years ago. I go, what? He goes, yeah, I couldn't walk 30 minutes. I go, what'd you do? He goes, I just decided it was time to get fit, and so I started walking, and then I started walking and said, oh, I feel like maybe I'll do some jogging, and why don't I do a 5K? Well, it was 5 mile at that time. And then he just built it, I want to run a marathon. And so for him, no, it didn't matter. So there's never too late. We have that little video clip of some of those hockey players. It's never too late to start. Certainly if you've been used to it and you've learned about your body and how to listen to your body when you're young, well, you don't have to go through that again. On the other hand, if you think your body is the way it was when you were 20 and you take the same recovery and you didn't really learn to listen to your body, or so you're not listening to your body now, you're thinking your body is the way it was when you're 20, then you're actually more likely to get hurt. So it's all about being self-aware about your body and what it can take, a little bit about the physical literacy that Patrice Aubertin talked about in the first week, I think. So just being aware, but in general, it's never too late, and I encourage everybody to stay active and be healthy and to become active and healthy if you're not already there.
All right, so the next question is, what types of exercises are okay to do every day without injuring yourself? And even on the flip side, what would not be permitted to do every day, or what would lead to injury if you do it every day?
So anything that you do that doesn't hurt you during, after, or the next day is good for you. That's number one. Anything that's causing you pain may or may not be good for you, because some people, with normal exercise, you get sore. And some people who aren't used to being sore, their brain interprets that as pain. Also, after an injury, or people who've been in pain for a long time, chronic pain, they've been in pain for 6 months, the wires to the brain get crossed, and what's normally interpreted as soreness can be interpreted as pain. So if you have pain, it might be bad, it's not necessarily bad. But you have to be very careful, because you don't want to be worse. If you're doing something and over time you're getting worse, you got to change something up. If you have a lot of experience, you might be able to do that yourself. If not, you seek out other advice. A lot of that is trial and error. In terms of a particular exercise, again, it's about what the capacity is. Every time you do exercise, your muscle's going to break down. As it breaks down, if you then do another bout of exercise before it is fully recovered, it's going to break down more than it did the first time. That's the level where you start to get into danger in terms of doing things over and over and over again. And what that time is depends on the intensity of the exercise. So and your ability. I'm currently walking an hour. I usually walk an hour to work and an hour back, so I don't do it every day. Maybe I do it 4 days a week or 5 days a week. I'm doing that. So I'm good for that. But someone who's only used to walking 5 minutes won't be able to do. I had a patient today. I see patients half a day a week, and it so happens that I had another different patient today who, when she came to me, she was unable to walk more than 10 minutes. And she was exhausted. 10 minutes and have to go and lie down. And just couldn't do anything, couldn't take care of the kids. And today she comes in, she's walking 45 minutes, and she's walking 4 kilometers in 45 minutes, which is a fast pace. And I was just amazed. And she's really happy. She still has some pain, but she's really happy. So, and all we did was start her at 10 minutes at a pace that she could do and then gradually build up. Had she done 45 minutes at the beginning, she would have been injuring herself and it would have been too much. So you got to recognize your limits and learn to listen to your body. That's the most important thing. And then super intense, what we talk about in general in loading, it's interesting, we talk about increasing 10 to 20% a week. So if you exercise twice a week for 30 minutes and you want to go to 3 times a week, well, that's 3 over 2, that's 1.5, that's a 50% increase. You might get injured. Chance, not that you are going to get injured, but your risk of getting injured is much higher than if you do a smaller one. So instead of going, you still want to go 3 times a week, if you drop down to 20 minutes, so 30 minutes twice a week is 60 minutes a week. You now do 20 minutes 3 times a week, still only 60 minutes. So same amount of time, less rest. You're doing it 3 times a week. Less rest means more stress to the body. So you're just increasing the stress a bit. More recently, I learned this rule, 10 to 20%, back in 1981, 82, when I was in medical school. It's only in the last year or two that Tim Gabbett, out of Australasia, because I don't remember if he's in Australia or New Zealand, and I want to be careful about what I say. There's rivalries in certain parts of the world. And so Tim has done some great research, for the first time actually documenting this 20%. You go above the 20% of your usual load per week, and you're more likely to get hurt. It's he's a great lecturer. And it's one of these things where it's so nice to see science finally tell us that what we're doing is good. We always hear about science telling us that what we're doing is bad. Here, the science has finally proven that what we've been doing all these years has been the right thing. So that was a nice change. Next question.
Sometimes people overdo it with exercise, especially if they enjoy an exercise such as stationary spinning. How do you avoid overdoing it? What is a good way to determine breaks in between activities?
Well, it was really along the same theme. You've got to listen to your body and just increase gradually. Pick a level that you're comfortable at when you first start, and then progress slowly. In terms of recovery and take breaks in between, again, there's just no hard and fast rule. If you're used to doing things with short breaks, it's going to be okay. And it's just about listening to your body. And just if you're not sure, go slow. And we talk about the Sing Talk test. That's a great way. That's for endurance. It's not so useful when you're trying to push a weight. If you're going to push a weight, one thing you could do is if you have to hold your breath, or if you don't have to hold your breath, the weight's not too heavy. It might be too light. I don't have to hold my breath in order to lift this wire. Like here, I don't have to hold my breath. So it might be too light. But if I have to hold my breath, that means I've got to stabilize my spine. And if I stabilize my spine to generate that weight, it might be too much. Most people training properly will hold their weight in order to generate a higher weight. I don't want to say it's bad. But if you're concerned, then the one thing you could do is just lift weight without holding your breath. That'll also keep your blood pressure from going too high, and a couple of other things. So that's one little trick that will work for some people. But again, don't go around telling people that they're holding their breath and it's bad for them. That's not the message here.
Right. So the next question is, sorry. I started doing my high-intensity exercise, which includes cardio workouts, yoga, and some strength training in my late 20s. Before this, I was just doing light to moderate activities. Does it have a positive impact on my cardiovascular and musculoskeletal health, or should I be cautious that I'm not overdoing it, as I am in my 30s now?
Age has nothing to do with the exercise. So whether you're 20 or 30 or 80, you could be doing all of those exercises. That's number one, most important thing. I have a friend, Scott Livingston, who's a trainer, strength and conditioning coach. He trains Olympic athletes here in Canada. And Elsie used to work with the National Hockey League. One of the things that he says is there are no contraindicated exercises, just contraindicated people. So as long as you, when you start yoga, you start easy and you progress slowly, it's not going to be a problem. Yoga is not one exercise. There's a whole bunch of different types. Some yoga is very relaxing and focuses more on stretching and spirituality, and some is all this high-intensity pump type stuff, and that's much more resistance training almost for me than yoga, but it's done within a yoga framework. So it's about what you're doing and where you are, and if you're now in those exercises and at the end of them you feel tired but you're not sore, then there's no problem at all. And just, again, start easy, progress gradually.
Okay. So back to spinning and overuse injury. I have a spin injury from over 3 years ago. I got a tear in my Achilles tendon. What is the best way to heal? I did go to PT, but it didn't help much. PT said I needed to stretch a lot to disrupt the muscle to cause it to heal in addition to other exercises. I still spin, but I can't go more than 2 times a week. It's much easier to get overuse pain than before. What are your thoughts?
So this is a live question.
Yes.
Because I wasn't ready for this one.
Yes.
Okay, so that's a really long question. It's Achilles tendonitis made worse with spinning classes. Okay. So the Achilles tendon, maybe we can use Andras here for the model here. So we'll pull this out. And hold on. We got, there we go.
Should I take my shoes off?
Yeah, take your shoe off. And I want you to lie down on your stomach.
Okay. Oh, wait, I'll take this one.
So we were joking before because Andras was going to wear shorts, and he decided not to, and I said, well, you can change on camera. So if any of you asks for a knee question or a hip question, you get to see Andras change on camera. Okay. No, you don't. So we'll do it without that. So the Achilles tendon, just so everybody knows, is over here. And that's the part of the muscle. Here's your calf muscle. And there's 2 superficial muscles here called the gastric and soleus, and they come up and they intertwine to form a cord called the Achilles tendon, which attaches to your heel. And so the Achilles tendon, when this muscle contracts, it pushes the foot up. Just relax. No, just relax. Don't help me. So I'm just going to squeeze his muscle, and you see his foot move. So that's how we know his Achilles tendon is intact. So if it's going to be, basically whenever that muscle pushes, the foot goes up. Every time you push up like that, that's going to hurt. In spinning, you've got your forefoot on the pedal, usually. But you don't have to. In some of the classes, if you don't have traps and you're not cleated into the pedal, you can put the middle part of your foot in. And then you don't have to use the front part of your foot. And so if you do that, you're going to work your quadricep, you're going to work the front of your thigh, just the same amount. It'll feel a little bit weird when you start, but it is one way that you could release some of the stress off your Achilles. Now, in terms of treating the Achilles tendonitis, the tendon, and now people call it tendinopathy and tendinosis because when we look at it, there's actually very little inflammation. Itis means inflammation. There's very little inflammation. So in this tendinopathy, we want to strengthen up this tissue. A lot of people used to only use stretching, so they'd stretch it out. And the idea is to, when you stretch, as we did the stretching class, I can't remember which classes we've done already. So when we talked about the stretching does a little bit of damage. So you can certainly do a little bit of damage by stretching, and then that will stimulate the body to react in the tendon, and then it gets better. It turns out, though, that stretching isn't a great way of trying to strengthen the tendon. Instead, we try and do eccentric exercise activity, or negatives, what they call negatives in the gym. Andras, I want you to stand. You're going to have to stand on this. Hopefully this will be solid enough. Okay. Good. Andras is working out his balance here. Turn and face, this way. So now the Achilles, if I have him just stand just on your left leg, okay, go up. That's positive. His muscle's getting shorter, go down slowly. Now as he's going down, that muscle is still working. You can try it yourself. You go up and then you slowly shift down. You'll still feel your calf working as it's going down. That going down is called negative exercise or eccentric activity. It's the negative part that actually works to strengthen the tendon. That was first shown mostly by a Canadian, Bill Stanish's group in Nova Scotia. He's an orthopedic surgeon. And so that was the mainstay for treatment for a long time. More recently, in the 90s and 2000s, some people have done it in the knee and shown the eccentric activity again works for knee tendonitis. And so we use it across all tendinopathies now. So in order to be able to get the eccentric activity, what I do, not everybody else does this, Andras, I want you to go up on both feet. Now lift your right one, lift your right and let yourself down. Easy. So now what we've done is he's lifting his body weight with both feet so that we're doing less, and then lift this one right away and then down. We don't want you to hold it. So by lifting up on both feet, he's actually reducing the concentric activity, when it's getting shorter where we don't get as much benefit, so we can focus more and tire it out on the eccentric activity. Now, it's also possible, why didn't I say, Andras, I want you to do something else. I want you to go up only on your right leg, switch over to your left, lift your right, and then down. That would be even better, but it's kind of hard, and people, at least in my clinic, I found that it was difficult to teach people to do that. Even this 2 up on 1 down, for people who aren't used to the exercise, they find it difficult to remember, and they come back a week later, and I have to correct them. I try the other way, it doesn't work. The other part is Andras is now doing that on a flat surface. So we start with that. As that gets easy and he can do that better and better and stronger, then we go on the same thing over a period of stress. So you could imagine if, here, let's pretend this. Here, go on, put this here. Pretend I'm a stair here. What would happen is he'd come down flat and then he could go below. So that would be the equivalent of a stretch. But we're applying the stretch during the eccentric activity. So it is a stretch, but it's not just that we're putting the full body weight, and then we have ways of making it even more stressful, but we don't have to go into that now. You've got to be careful about this. You can come down now. Any exercise that's rehab for strengthening, if you overdo it, you can get worse. You will get worse if you overdo it. And so it really should be guided with a therapist. Different people have different programs. If you're not responding to the particular exercise program over 3 or 4 treatments, let's say over 1 to 2 weeks, you should be noticing some improvement, then it really should be reevaluated. Sometimes it's expected because it's so sore, or maybe you're irritating it elsewhere. The exercise isn't the magic bullet. If you're doing the exercise, but at the same time you're at work and you have to walk at work 8 hours a day, the exercise isn't going to overcome that part of work, and so we have to figure out how to give your Achilles some extra rest, because it's a cumulative activity, not just what you're doing during spinning or during this activity. So we've got to be a little bit more I mean, if it was easy, then, and everybody was the same, then we would just have recipes and you could just follow the recipe. We have to try and tailor them to you as a patient. So the best thing is to go and see your sport medicine physician or physiotherapist or athletic therapist or some healthcare professional that's used to treating injuries to guide you. Again, 3 or 4 or 5 treatments and you should be noticing improvement. And if you're not, the treatment program in general should be changed. But speak to your healthcare professional for more guidance.
And just a quick follow-up on that. For these kinds of things, like for tendonitis, do you notice, in your clinical practice, do you notice a full recovery, or is there going to be lingering weakness?
There are, most people get better 100%. They go back to everything they want. There are some people who don't. And the nuances of what that is, and this isn't the forum to go through exactly when people don't. There are people who have pain for years, and then they drop their activity. And so one of my friends had Achilles pain for a long time, and then he started the exercise program. And he got back up to running 45 minutes. But if he went to an hour, he would have pain. So he stopped at 45 minutes. But he was able to run 4 or 5 times a week without 45 minutes without pain. Is that normal? Well, not for him. He still would have liked to have run longer. But that's a pretty acceptable result for me in terms of wanting my patients to stay healthy.
So the next question is, how long is the recovery time after an ACL operation to go back to a sport like soccer? And he's noticed that a lot of people have an ACL operation twice on the same knee. So what do you advise for them? Like, how do you avoid that kind of re-injury?
The anterior cruciate ligament, it's a very particular, the ACL is the anterior cruciate ligament. It's a ligament inside the knee. It's really important for most of us. There's some people who lose their anterior cruciate ligament, they never have problems. I don't understand how, but they don't. When it tears, it doesn't heal. Not everybody needs surgery. In those that go for surgery, there are different types of surgery, and they have different recovery times. And the different surgeons have different recommendations for the different recovery times. It'll be a little bit dependent on your age, but in general, they sort of have recipes. Some want 6 months, some want 9 months, some want a year. We know that the actual, if they operate in certain types where they replace the ligament with a tendon, that sort of takes about a year for it to be strong, but they'll let you go back at 9 months because is it strong enough for the risk? Often people will tear their opposite knee because it has something to do with their actual, either their biomechanics or their anatomy. This is a huge debate in the sport medicine research as to what's the causative factor in any particular person. People re-tearing the same one. You know, what we do know is your balance and your position sense and the way you land, your biomechanics of landing are super important. And so we do a lot of work on that in trying to teach people to just jump down from a short height and land without letting their knees collapse. Can you see my knees here? So if you jump, some people land like that with their knees collapsing, and that puts a lot of extra stress on the ACL. And if we can teach people to land and their knees come straight, then there's much less stress. But if they have to think every time they're jumping, then they're not going to be thinking when they're playing the sport. So it's about the training. And once they're trained to do it, it's to switch their, what we call central programming, so their muscles are being coordinated. Again, coming back to that first question about isolating a muscle, we don't want that. We want the muscles to work together to avoid the knee from collapsing in. And once that becomes your automatic program, then that's our goal with that type of training. It takes a long time to do that. And that would be the most important thing, I think, at this point, to prevent recurrent ACL injuries either to the same knee or to the other. Let's go back to some of the questions that were sent in before.
Sure. How long, how do I recover from a back injury?
How do I recover from a back injury? Okay, Andres, the principles are the same as anything else. With the Achilles, we want to remove the stress that you're applying. Lie down on your back. Okay. Yeah. We want to remove the things that are aggravating it. So we reduce the stress, and we want to increase the stress that your back can absorb. So first, if you're thinking about, oh, I've got some back pain, and it hurts you in the morning, one of the questions is, are you sleeping on your stomach, and does arching your back hurt? If that's part of the problem, you stop sleeping on your stomach. Or you can do some other things where you bring your knee up to your chest, which automatically bends your hip. A lot of people have back pain when they're weightlifting. And so I'm going to have Andras here pretend that he's doing a bench press. I want your feet up here on this. Okay. Okay? Now what people will do when they bench press, bench, and the back arches. And the reason the back arches is because you contract all the muscles around the spine in order to stabilize it. The idea there is if you try and jump in the air when you're standing on ice or a slippery surface, you can't jump very high. In order to jump high, you have to generate friction. It's got to be a stable surface. And so Andras, by contracting all of his back muscles here, he's stabilizing all of those vertebrae, and that would allow him to push more weight. Now, if we want to get rid of that, we can ask him, okay, just don't do that. But another way is I want you to lift your feet up, right? Cross your things. There we go. Now, when Andras pushes, it's actually much more difficult. Now, you can arch your back. Try and arch your back. He can do it, but I can't get my hand underneath. Do the other way again. Arch your back. I can get my whole arm. So one of the things, it's just one way that you can protect your back and reduce the stress during normal things. Now, how do you actually get better? We still want to improve the muscles. Everybody in the past used to talk about abdominal muscles. There's been a ton of research showing that abdominal muscles, the strengthening, doesn't really matter that much. Andras, I want you to lift this, come down. I want you to lift that bag. Okay? Now, if you notice, when he lifted that, did he use his abdominal muscles? What do his abdominal muscles do? Do it again. Okay, so lift the bag. Okay, so what do abdominal muscles do? They bend you forward. He bent forward, but that's just gravity that's bringing him down. When he lifts it up, that's his back muscles and the side, and his abdominal muscles work to some extent. I'm not saying they're completely unimportant, but they're much less important than the back, especially if you get the pain because you've been shoveling snow or doing things a lot with your back. Same way if you hurt your hamstring, you would be trying to strengthen your hamstring. If you hurt your back muscles, you want to strengthen the back muscles. There are other different types of conditions that hurt the back where strengthening your back muscles might not be appropriate. I'm just mentioning it because it is the one thing that most people forget. And so people do planks. Here, you can sit here. So people do planks. I'll show myself here. And they'll do front planks like that. And they'll do side planks like that. I can't do it because this is a little bit shifty. But what they forget is that works the side and the front. It's the back planks that work the back. And so we want to strengthen the back. Back planks are one, but there's a whole series of different types of exercise. The other thing that comes from back pain is that when we think about core, people talk about the core, that's all around. Although when we lift, we use our back, most of the time when we're lifting and we're moving things, we're in a straight position. And so it's not about doing the crunches. It's about making sure that your muscles work in a coordinated fashion during the types of activities that you're used to doing. And so planks are good because they work the muscles when they're straight. The only difference is you don't have to hold it 30 seconds. You only have to hold it 5 to 10 seconds, and you can rotate. Most of this research has come out of another Canadian. I'm beefing up all the Canadians. But Stuart McGill's famous biomechanist in Ontario, the province next to us. We're in rivalry with them too, like Quebec, this sort of. But anyway, brilliant stuff and a huge amount of scientific research supporting it. And just about trying to think about how we functionally use the muscles, and then let's train them in that mode. And that's the best way to recover for any muscle in any part of your body.
Is there a scientific definition of overtraining? How would an individual identify that they're overtrained and they need to cut back on their volume or intensity?
So overtraining, we have 10 minutes left, so we'll try and keep it a little slower, faster. But overtraining is a medical term that we use where people are training and instead of getting better, they're getting worse. And then that comes associated with fatigue, they're just feeling tired all the time. They might not be sleeping well. They might start to feel sad or get depressed. And whether those are because their training's getting worse or it's a little bit of a complex phenomenon. But basically, overtraining is defined as your performance decreasing despite what would normally be considered appropriate training. When that happens, the current thoughts are you've got to take a long break and give your body a whole, like it's months and months of rest and sort of stop the training and then you come back. But everybody's different. And so, taking an elite athlete and telling them that they have to stop training for 6 months or 9 months doesn't really work. And philosophically, the idea is really just to bring them down to a level that their body can absorb, and that's appropriate for their body. It's just tough to try and figure out what that level is, and that's the art of medicine or the art of therapy, the art of coaching, is to try and be able to figure out what that is for this individual. I'm not a coach, so I don't deal with that. I don't see overtraining with elite athletes, but it is a serious problem. And often it's recognized just too late because people aren't doing well, and the idea is, oh, you're not training hard enough, and you don't always train it from your coach, and then the coach might not believe you, and creates a whole psychosocial phenomenon, and it's difficult. We don't have a blood test for it. We don't have a way of saying, oh, gee, this is it. And people are working on it, but the tests just aren't that good.
So is overtraining to that extent, is that common at all in the general population, or is that only really seen in athletes?
That's the overtraining that I'm talking about is really about performance and is seen in athletes. Overtraining for a general population would just be, hey, you're used to running twice a week and you decide to go to 4 times a week and then you develop Achilles tendonitis. You could think of that as overtraining as well, but it's not the term that we give to it. That we'll call as training errors. We reserve the term overtraining syndrome, usually, at least amongst the colleagues that I talk to, in order for this really whole complex situation of decreasing performance. Next.
Is it necessary to do cardio before weight training session as a warm-up? And inversely, not inversely, but following that, is it okay to do cardio post-weight training?
In terms of injury, it's not going to make a difference. The key is not the temperature. So if you do warm-up with spinning before you do weight training, that will give you some warm-up for your legs, but will give you nothing for your arms. And so you still need to warm up for your arms. You don't want to all of a sudden go in and do 4 sets of really heavy bench press because you haven't warmed up those muscles. And so the warm-up for weight training is generally go with very light weights and go and do a couple of, light weights, do 5 sets of 5 or 10, just something to move your body in that motion before, and then you go through all the exercises and then you can start your regular program. Some people will warm up just before the exercise and do each one. There's no magic here. You just don't want to expose your body to a high load immediately without giving it some advance notice. And doing it after certainly is great. There's not a problem. But again, if you were working your Achilles really hard in the weight training and then you go running, that's a lot of stress on your Achilles. So it depends on your program, and it should be balanced, and make sure that you're not overusing, as opposed to overtraining, that you're not overusing any particular muscle or tendon or joint when you combine the two activities.
So there was one student who was asking, what kind of exercise would be contraindicated for multiple pregnancies?
So pregnancy, again, what we don't want is, in pregnancy in general, is for you to hold your breath, for things where you're lying on your back, because you block sort of the blood flow back, and depends on how far along you are in the pregnancy. In multiple pregnancies, in multiple gestation, where you have multiple babies in one pregnancy, then the weight and the distribution is just much bigger. And so it's the same problems multiplied, and you have to be more careful. The other problem is that people are a little bit more prone to have labor a little bit earlier. So people get all worried, and you have to speak to your obstetrician of whether you're a high-risk pregnancy. It depends on where the placenta is. The placenta is the part where the baby gets its oxygen. The oxygen and all the nutrients get transferred from the mom to the baby, goes through the placenta. It depends where the placenta is. So we talk about that in the pregnancy lesson. And so with multiple births, you can have 2 placentas, so you can have a little bit more of a problem. So it's, by definition, a little bit higher risk, and you should check with your obstetrician or your family doctor as to what's appropriate for you. From a musculoskeletal point, if you have no pain during, after, the next day, it's going to be okay. You can start slow, progress gradually. When you start to feel that the weight's getting bigger, because you're getting bigger faster, remember, you're putting on that weight. That's more extra stress, only 10% increase per week. But if your weight's getting bigger, all of a sudden that's a much bigger weight. Maybe you have to start dialing it down a bit. And so you just got to play with those factors. There's no set rule.
And do the recommendations, like the exercise recommendations, change the number of pregnancies that an individual has had? So for the first pregnancy versus their second, do you know if that's the case?
We don't change. No, the exercise recommendations don't change with the number of pregnancies. With the particular pregnancy you have, it might, if you're likely to have this placenta previa, if you've had early rupture of the membranes, you might not want, like they might advise certain things. Those are high-risk pregnancies. This course is about the general population, and high-risk pregnancies always have to be managed on a case-by-case basis.
Would you like a new question?
Sure.
This one
We've got one, well, we do have that one that the person was begging to be asked. So let's do that
sure.
one first, just because I don't have an answer. But
Okay. I'm a girl with PCOS, which is polycystic ovarian syndrome. What kind of exercise is recommended for people with my problem? Will regular workouts help eradicate PCOS?
So polycystic ovary syndrome is where you have cysts on the ovaries, and no exercise is going to change the cysts. You can have multiple the symptoms that go along with it are very varied. Some of them are related, sometimes can be related to hormonal imbalances. I don't know of any exercise program that's ever been tested in patients with PCOS. If you feel better with the exercise, then that's a good thing, and I would do it. And in general, the exercise should make your mood better. It'll help strengthen your muscles, and it does a lot of good in a lot of different systems, but it's not specifically going to treat the ovaries. So I don't want to, I would be very surprised. Maybe 5 years or 20 years from now, somebody will come up and they'll say, oh, Schreier was an idiot and he was wrong and he just, perpetuated myths. But anyway, at this point, I can't think of a way that it would actually help that condition.
So a question from Alex from Bolivia. He's wondering, is there any positive or negative influence in practicing sports in higher altitude environments?
From a health perspective, no. From a performance medicine perspective, there's this idea of train high, if you go to high altitude, you change your blood composition so you get more red blood cells. When you do that, you can carry more oxygen, and if you carry more oxygen, you do better in endurance events. So it's not going to help I can't think of a theoretical reason why it would help in something like a weightlifting program. It could help in something like a mile run, right, or the 1600K run. In long endurance runs, it can help. There's some pros and cons to how you do it. But one of the things when you do that is that the blood gets more blood in it, and then there are side effects to that too. So it's like the blood doping that Andrew Pipe was talking about. And if your blood gets too thick, you're more at risk for a stroke. I'm not saying if you train at high altitude, you're going to get a stroke. But the reason you're training at high altitude is to increase your red blood cells. And if you already have high red blood cells and you increase them more, you could theoretically put yourself at risk for a stroke. And so these types of when we have people train at high altitude for elite performance, they're monitored. And they're monitored in different ways with certain blood tests and through sports scientists and through other healthcare professionals to make sure that they're doing so safely. We've got 30 seconds. Is there any burning question that either of you want to ask and make some student happy? You just want them to be miserable? No.
Not really.
Well, thank you. It's been great. Thank you so much for all of your questions before and after and during this live session. Keep them coming. We do have the live session at the end, so we will cover some of those as well, but also on the discussion board. And those of you who are part of the cohort that are in sort of high performance cohort, there have been some great discussions in that group. There's been some great discussions in the in the non-high performance cohort. And a lot of you have a lot of knowledge to share. And what we're here is to allow you guys to share that, and we'll throw in our 2 cents where we think it's helpful, sometimes where maybe it's not so helpful. And please let us know when you think it's not so helpful as well. Thanks again. I hope you continue to enjoy the course. You can follow it as always. We encourage you to follow it in order. But if things are running out and you want to see some of the lessons later, we've made them available and so that you don't miss them. And we hope you enjoy the course. And we really appreciate any feedback you can give, which sessions work and whether this live session worked well for you as well. Thank you very much. Thanks, Andras, Jasmine, Melanie, manning the discussion board and bringing them forward to us, Jimmy and Frank at the cameras and the audio. Thank you so much.